I just wrapped up an awesome Ask Me Anything live stream on YouTube. It was a lot of fun. This is the after party, where I go through all the questions I didn't get to and I answer them. If you want to hear those answers, don't turn away, because that after party starts right now. Howdy! Thanks for learning about MS with me, Boster. I started this YouTube channel to help my own MS clinic patients learn between visits, and it's my hope that through these videos, I can help you learn too. This morning, I participated in an awesome Ask Me Anything live stream event on YouTube. I love doing that with you guys. It was super cool to wake up on a Sunday morning, grab a cup of coffee, jump online, and have almost 100 people from around the globe join us to talk about MS and to answer your questions. I really enjoyed it. I also used the opportunity to talk about how we currently diagnose multiple sclerosis and also our current understanding of what causes MS. With this video is the after party, where I go through the questions I didn't have time to answer during the live stream and I make sure that I can address them. So let's jump in right now. Candy Duncan writes in, "Good morning. How does MS affect teeth? Or is it medication side effect?" Howdy, Candy. Excellent question. MS has no direct effects on the teeth or on dental hygiene. But as you point out, certain medications can impact dental hygiene and teeth. It's also, of course, super important that we brush our teeth twice a day, that we floss regularly, and that we see the dentist. That's true whether you have MS or not. Thank you for asking the question. Mike asks, can a regular MRI brain scan show up MS, or does it need to be a scan with a particular way to check for it? Mike, that's an excellent question. An MRI you can conceptually think of like a camera. And if you grab any old camera, you can take a picture of something. But if you really want to bring out the character of whatever it is you're taking a picture, sometimes you have to change the camera or change the way you use the camera. For example, if you're going to be taking a picture of a flower garden, you're probably going to use color photography and you're going to want really good lighting. If you're trying to take a picture with a sepia sort of oldish feel to it, you're going to set your camera up very differently. Well, the same thing's true in the MRI. If you use the MRI to ask an MS question, it really brings out some of the subtle findings that might be missed with a normal scan. That's not to say that you can't use a normal brain MRI, because you can. It's just a little better if you use what we call an MS protocol. Ian asks, can coffee help managing MS? I make a joke, Ian, that I learned a long time ago how to translate coffee into neurology. Because as you know, I drink a lot of coffee, it keeps me energized and keeps me awake, and I use that energy to help provide care to families with MS. So in some ways, I would say yes. Gia Diane asks, at what point of disability should I consider discussing a handicap placard for my vehicle with my neurologist? Well, that's a very excellent question, and it's actually a complex question, and let's unpack it a little bit. A handicap placard here in the United States allows you to park your car in a handicap spot, which is typically right in front of a store, and it cuts down on your walking. Now, I think that I would like to think about this in two different scenarios. If you are ambulatory and you don't have a specific limit to how far you can walk, but maybe you're at risk of being deconditioned and getting in some extra steps will help condition you, it's this situation where I don't want you to use a handicap placard, and I want you to park on the other side of the parking lot, as far away from the door as possible, so you can pick up some steps on the way into the store and on the way back. It's a way of adding in a little movement into your day. There's a different scenario where someone might be using an assist device and they might have significant motor fatigue. And they may find that if they traverse the entire parking lot, they're exhausted and they can't then do what they need to do in the store. That's the situation where I think a handicap placard comes into play. Because in that second example, the person can drive right up to the storefront and then they can do their walking in the store and they can get done what they need to get done and they're not too tired. And so I think if you fit into the second category, it's completely a good idea to talk to your provider about the potential of getting a handicap placard. Megan D. from Indiana writes in, is it normal to have very difficult time with side effects from prednisone? Weakness in legs, horrible mood swings, etc. Megan, unfortunately the answer is yes. Prednisone is a necessary evil, and unfortunately the doses that we need to treat an MS attack are really high. We can see a lot of side effects with prednisone. I like to warn people before I give them high-dose prednisone. It can cause insomnia, irritability, it can make you retain water weight, it can make you super hungry, but it makes food taste bad, it can make you very irritable, it can create mood swings, it can cause headaches, it can make it hard to sleep at night. There's a lot that can go on when taking prednisone. But everything, Megan, is a risk-benefit. And God forbid you're blind in your eye from an MS attack or can't move your leg from an MS attack, one might argue that the short-term effects of prednisone, as disgustingly yucky as they are, might be worth the benefit of regaining your neurological function. I do want to highlight that the side effects of prednisone, when you're taking them high dose like that for a short period of time, are short. And typically in under a week, all those side effects have gone away. Now there's a couple precautions when taking high-dose steroids that I want to remind us of. If you have diabetes or gestational diabetes when you are pregnant, if you have a history of psychosis or steroid psychosis, or if you've had a GI bleed, you don't want to just take prednisone. You need to make sure you bring that up to your clinician and say, hey, I had these things happen, is it still safe? Because there might be some specific precautions that we need to implement before taking the steroids. Linda writes in, hi, can an old inactive lesion cause pain? Linda, the answer is yes. And the best way that I can explain this is to use an analogy of an extension cord. If you have an extension cord and you ran it over by accident with your lawnmower and you didn't cut it in half, you just nicked it, and so you duct tape it up. The damage to that electrical cord is past tense, it's already occurred. But every single time you plug it into something, it kind of sputters and short circuits a little bit, or it'll flicker. In the same way, your nervous system, after it's suffered damage, doesn't work the same way that it used to. So an old lesion, an old piece of damage, can cause ongoing neurological problems. If there's a lesion that's in part of the pathway that controls sensation, then you can get false sensations to your brain telling you that things hurt, for example, when they don't. So the short answer to your question is yes. Swati asks, is meditation helpful? Absolutely. I have many patients that find that meditation or similar activities are profoundly helpful to their quality of life and their well-being. I've heard people tell me that meditation, simply taking quiet walks, yoga, other mindfulness exercises are all outstanding. And so if you are inclined to try one of them out, I certainly would recommend that. Natalie asks, when I was diagnosed, I was told that many of us find out about our MS after pregnancy. Why is that? Natalie, that's an excellent question. When we become pregnant and a fetus is growing inside of us, half the genetic makeup is foreign. It's your partner's. And under normal circumstances, your immune system would try to kill the foreign DNA and clear out this foreigner. Well, that's counterpoint to a pregnancy. And the placenta makes very high levels of a hormone called estriol, which is an estrogen. And those super high levels of estriol protect the fetus. They also protect the rest of the body from the immune system. And we've learned from population studies of women with MS who are pregnant that in the second and third trimester in specific, MS is very quiet. But after you deliver the child, you deliver the placenta, and the estriol levels fall down to normal. And we learned that in the fourth trimester, it's my way of saying that 3 months after pregnancy, there's an increased risk of MS attack. So to speak to your question, imagine that you haven't been diagnosed yet and that you have a child, and after the delivery, in this period where there's an increased risk, you have your first attack. That is not an uncommon story, and I hope that explains to you why. Kate McGinney asks, I'm about to start Tecfidera. Is there any suggestions that you have to reduce the potential side effects? I'm a little nervous about flushing and burning all the time. Katie, thank you for writing in, and there are several things that I might recommend. Number one, make sure you're taking the pill, which is given twice a day, at the same time points. I've learned from patients that even varying it by an hour or two sometimes leads to undue flushing. Number two, Make sure to take the medicine with food. I cannot stress the importance of this. You need to eat a meal prior to taking the Tecfidera. Number 3, after you've checked with your provider to make sure that it's safe, you might consider taking a baby aspirin a half an hour before your pill so that you can prevent the flushing. Aspirin blocks prostaglandins, and it's a prostaglandin phenomenon causing the flushing. Again, make sure that you talk to your provider before you choose to do this one. Mama writes in, how does stress affect this disease? Mama, no one goes home at night and says, honey, let's get stressed out. And it's my opinion that in the setting of stress, we can see a worsening of chronic symptoms. It's not my opinion that stress can cause MS, but it is my opinion that stress can exacerbate our chronic neurological symptoms. Look guys, I'm in a little box. Please consider subscribing to the channel and ring the notifications bell so you don't miss out on any of my future content. Thank you for learning about MS with me, and until my next video, this is Aaron Boster saying take care.